pleasure to be here and joined by my colleague Karen Hyams, and we will be hopefully engaging the audience today in learning about healthy lifestyle behaviors and some tips living with prediabetes and diabetes. So first of all, I'm not sure in the audience how many of you have already been diagnosed with prediabetes, or diabetes, but we wanted to just begin by clarifying the different types of diabetes and then talk about ways in which we can approach and come up with helpful, healthy lifestyle tips and strategies to live day to day. So the first is prediabetes. Blood glucose levels are higher than normal, but not yet quite in the diabetes range. And what are we talking about? We're going to discuss the normal ranges of glucose levels. To when you go to your physician and you have your annual testing, you're always being screened for diabetes on a regular basis through your blood work. So we want you to understand what that is. When your blood work crosses over to an abnormal range, type 2 diabetes, so the cells no longer can produce or have insulin resistance. So they're not working like they normally would. So the cells do not use the insulin well in your body, and the ability for your pancreas to make insulin decreases over time. Unlike type 1 diabetes, the pancreas no longer makes insulin. So you actually have to take insulin injections on a daily basis to really live, because you need insulin to live. Okay, so we're going to move forward and we're going to talk. So how do you delay type 2 diabetes? You can use medications. You can use some types of supplements, although that at times can be controversial for a first-line treatment. But really, with type 2 diabetes, we're always looking to treat with lifestyle modification first. And that's the ADA standards of care. So we're going to talk today a lot about that and really get you to understand that it is a lifestyle disease, but over time, your pancreas can change and you could require medications to sustain. So initially, we really want you to engage and understand that it is lifestyle tips and behaviors that can really help you. So the diagnosis of prediabetes and diabetes, if you look at the chart in the lower section, sorry about that. The healthy section is when you have this test done, it's called the hemoglobin A1C. And that test measures your red blood cells and looks at the amount of glucose on the protein wall outside of your red blood cells. And this test is done every 3 months, and it's a measurement of your overall average of diabetes glucose control. So for someone who does not live with diabetes, their normal range should be less than 5.7. And so if you look at the bottom of the chart, their hemoglobin A1C is in the 5.6 or below range. When someone enters in prediabetes, that means that you're starting to develop some insulin resistance. Your hemoglobin A1C level might range from 5.6 to 6.4%. So that's the percent of glucose that's accumulated over a 3-month period on your red blood cells. And then as diabetes is diagnosed, when you cross over the threshold and your hemoglobin A1C approaches 6.5%. So if we talk about that also in glucose levels, which some of you may be more familiar when you go for your lab work, you may see this test, hemoglobin A1C or hemoglobin A1C on your report, but you also will be looking at what your fasting blood glucose level is. And in order to get a diagnosis of prediabetes and diabetes, you have to be fasting, meaning you haven't eaten for a certain amount of hours. Usually it's about 8 hours when you go for your blood work. And so if you look at the healthy levels, we would prefer your glucose level to be less than 100, fasting or below. A diagnosis of prediabetes, the glucose level is 100 to 126, and above 126, the glucose level is a diagnosis of diabetes type 2 or type 1 diabetes. So we're looking at these levels along with oral glucose tests, although most patients these days and physicians order the fasting glucose level and a hemoglobin A1C for diagnosis. So when we're looking at risk factors,
questions mid-talk, you want to hold till the end?
Yeah, I think we will hold questions for the end, and you can put those in the chat. Thank you. So fasting risk factors for type 2 diabetes are often, and most patients know, if they struggle with their weight, sometimes that could be a risk factor for developing prediabetes and diabetes. Having a very sedentary lifestyle, a family history is a strong determinant of type 2 diabetes, and also prediabetes, and also gestational diabetes. Many pregnant women who develop diabetes go on to develop diabetes after their first or second or third pregnancies. So it's critical that we kind of diagnose those patients early and continue to work with them to prevent the development of diabetes. Age, of course, can be a contributing factor, as well as ethnic background and racial backgrounds. And as you can see, certain populations have a higher incidence of diabetes: African American, Hispanic, Latino, Native American, and Asian populations. And a lot of that is attributed to, we think, genetically, many patients and many populations have begun to change their eating habits and dietary habits, and so it puts them at higher risk for development of diabetes with these other risk factors. Okay, so how can we delay type 2 diabetes and prediabetes? So when I talk today, that's going to be one of our strategies that we're going to really focus on. So whether you have diabetes or prediabetes, or are looking to prevent diabetes because maybe you have a weight issue or you have a family history, we really want to talk about, although medications and the role of supplements are critical as well when needed, we're going to focus today on lifestyle modifications. So the 4 most important strategies are weight loss, exercise, nutrition planning, individual nutrition planning, but also medications may be necessary even early on, such as metformin and other medications which have been shown to improve prediabetes and diabetes and insulin resistance. So we don't want people to think, even out of the gate when they're diagnosed, that if they're put on medications, that it's really something that we feel would benefit them and really help them in terms of prevention. So let's talk about what are the 7 healthy identified behaviors. And both myself and Karen are certified diabetes care and education specialists. And so we kind of follow the model of these 7 behaviors when we're working with patients, because we think it's a great strategy to identify and coach them and find out what are the areas they'd like to begin to work on in terms of their management. So the first one is healthy coping. And so when patients are newly diagnosed, we want to make sure we're looking to help and provide and allow them to seek support. So the diabetes healthcare team, educators, providers, physicians, nutritionists, diabetes care and education specialists, along with other team members, as well as family, we all look for patients to kind of reach out to provide support initially when they're first diagnosed and during their transition after they've been diagnosed. One of the things that's really critical as well for coping is sometimes you're under a lot of stress at the time of diagnosis. So we want patients to realize and identify that exercise and activity helps to, in terms of helping their mood and helping them identify ways to have healthy changes in their lifestyle. We want them to think positive, because a diagnosis of diabetes does not mean that you can't take control and that you can't, with education, live a healthy lifestyle. And we also want you to be good to yourselves, because it's really difficult when you're first diagnosed with a new medical condition. So it can be overwhelming. So we want you to understand that there's strategies that we're going to learn about today. So of course, everyone always associates healthy eating with diabetes, and it is the number one strategy, but there's many strategies that we'll use. So we want you to collaborate with your healthcare team. We have nutritionists and certified diabetes educators that work with families to set realistic and achievable eating goals, consider different kind of eating habits. So when we're doing meal planning, we really want to take into consideration what fits best for you, your cultural differences, the way you like to prepare food at home. So we really individualize what we can do to assist patients in the meal planning portion of their therapies. And we want them to learn appropriate portion sizes, especially today in America. Things have become supersized, and that's really been misleading for patients. So we kind of teach them what's the appropriate sizes of food portions that they should be utilizing. We also want them to understand nutrition facts on the labels. There's a lot of products out there and some things can be very misleading. So depending on what your weight and your nutrition goals are, we're going to help you understand what products to buy and how to really, decipher and look at products when you go to the supermarket. Know the carbohydrate food and portions to avoid blood glucose spikes, because it's carbohydrate that's broken down into glucose and can impact your glucose, as well as, if taken inappropriately in terms of portion, can affect your weight. We'd also like you to be aware of the sodium and saturated fats. So when we're working with patients with prediabetes and diabetes, we're not just looking at blood glucose levels. We're also looking at blood pressure and their, other variables that we want to make sure that are going to keep them healthy, like their blood pressure and their weight, as well as their blood sugars. And we're going to adjust the meal plan for physical activity and holiday and travel. So when patients come to us, we want to make sure, depending on their medications, we don't want them to have low blood sugar control. So we want to make sure that they're not hypoglycemic. Okay, so when we look at a healthy meal plan, what kinds of portions and what kinds of types of food are we looking at within their meal plan? We're looking at everyone having a balance of different types of foods, carbohydrates, such as whole grains, breads, cereals. We look at brown and healthy carbohydrates, such as quinoa and whole grains, lentils. Those are the kinds of things that we're suggesting, but also taking into consideration the likes and dislikes of a patient. We want you to incorporate healthy fruits, as well as vegetables, protein and dairy, and healthy fats and oils. So all of those things comprise a healthy meal plan. So one of the things that's been very successful in helping people to kind of identify, how do you take all of these ingredients and put it together and always have a healthy meal? So if you look at this model called the healthy plate, it really helps to give you a better sense of what you should do with your portions. And when we look at a plate, we're talking about a 9-inch plate, and we want you to divide the plate in half and use that for healthy, starchy, colorful vegetables and salads. And that's where you're going to get your fiber, and that helps to slow down glucose. And then a quarter of the plate should be carbohydrates. So the things that we spoke about earlier, your pastas, and we want healthy carbohydrates, different kinds of rice and quinoa. And also the final quarter of the plate should be lean meat, fish, chicken, and tofu. Those are some examples of healthy proteins. So the next healthy behavior that we'd like you to kind of take into consideration in terms of your activity and your plan is being active, right? So most people are very sedentary today just because of lifestyle. So people have to really think about the benefits of exercise and activity, lowering the blood sugar, lowering the blood pressure, cholesterol, the risk of health disease, and the risk of stroke and stress. It's a great stress reliever, but it also improves all of those things. So it helps your heart, your muscle, bone strength, joint flexibility, insulin action, and blood circulation. So the exercise is something that we have to really think about incorporating on a daily basis, if possible. And we're going to talk about ways that you can do that. So the recommendation by the U.S. Department of Health and Human Resources suggests that we all Americans and all individuals living with diabetes or just wanting a healthy lifestyle should be doing 150 minutes per week. They've recently questioned that, but it turns out it's about 30 minutes a day, and it does not have to be done in one, portion of time. You can kind of break it up into 2 or 3. You can walk 10 minutes in the morning or 10 minutes in the afternoon, 10 minutes in the evening. But we really want you to get those 150 minutes per weekend of some kind of aerobic activity, which means that you're walking and swimming. Some people like to do other more intense aerobic activity, but everyone has to take into account what you're physically able to do and discussing it with your medical team. The other critical element is building muscle strength activities. So this should be done twice a week. As we get older, everyone loses, even after the age of 40, we all lose muscle mass every day. So we have to be really careful that we're replacing and doing activities to continue to build and maintain muscle. So here's some simple ways to be more active. I think as we have been all in because of the pandemic and we tend to be, using a lot of technology, we have to think of ways that we can build activity into our day-to-day life. So walking your dog or working in the garden at this time of year, even cleaning your house is considered activity, as you can see. Other things at work, like getting up and exercising from your chair or taking the stairs. And then, of course, leisure activities when you're going out, walking to a restaurant or walking or parking far when you go into a store in the parking lot. And also using devices to help track your steps is very helpful to just kind of keep you on track and let you know what I'm doing really well and I've done my 150 steps, or maybe I need to do more activity. So the other ways to increase activity, which we mentioned some of them, but if you really look at your daily activities, what kinds of things do you really like to do? That's most important, and start slowly and with supervision from your healthcare team. So there's lots of things as you look around that you might enjoy, like joining a yoga class, even if you have to do it, chair yoga, or get a buddy to keep you accountable so you can go out and do activity. So it's important to pick something you like, obviously, and take it slow. Don't overdo it. And make sure if you are monitoring your blood sugar that you're checking before, and especially after exercise, because exercise can lower your glucose for up to 24 hours. So you want to make sure that you're always prepared and you don't have a low blood sugar after activity. And keeping track of your activity, write down the time of day, because there's certain times that are better and more beneficial, like, for instance, after meals. When your glucose tends to spike, that may be a time when it's best to kind of help you control those peaks from the meal. So going out for a walk in the evening after dinner, which might be your largest meal, or during work time, going out for a 10-minute walk after you've had lunch at work. Find someone to help you or take a class. All of these things are helpful. So the next thing we're going to touch upon is taking medications, which is, at times a critical component of diabetes lifestyle management and care. So as diabetes progresses, it's not unusual that you might have to take some medications, and there are other medications that are prescribed even at the time of diagnosis, because we know them to be helpful to protect you and keep your heart and your kidneys and your eyes healthy. So medications like metformin, sometimes these medications might have side effects. So we're going to talk about, working with your health provider, first of all, to choose the right medications. They're going to be doing that, but you play a really critical role, because if you have side effects or if you're not sure about the medications, this is the time to really write down your questions and open up a conversation with your physician. So it's really critical that you understand why you're taking the medications, when you're taking them, and that you're taking them the right way at the right time of day. And making your medications work for you. So a lot of patients say, well, I skipped 3 meds because it's just too busy and I can't do it. So we want to make sure that you're keeping a list of all your current medications. When you come to your appointments, we want to make sure that we fill all your prescriptions. If you don't have your medications, that's already a problem. So that's a really good time to go over how you're doing on your medications, if you're struggling with the timing or some of the side effects, because we want to know that, because maybe there's other choices that we can recommend. And we really want you taking your medications at the right time so that we can evaluate. And we're going to talk a little bit about how we evaluate your medications by monitoring. We also want you to make sure that if you're using injectables, a lot of people today, even if they're not on insulin, they might be using medications that require injections. So you might have to dispose of your needles. So we would teach you the appropriate way to get the right containers to dispose of the needles and the medications and the so someone doesn't get injected mistakenly by a needle prick. We want you to share your medication beliefs and concerns at your appointment. So did your medication have positive effects on your health? Did your medicine cause you to have a low blood sugar? We need to understand that at your appointments, because maybe it was your meal plan or your activity and not necessarily the medication. So we want to know all about when these side effects occur. Are you concerned about the number of pills a day? There's a lot of medications today that we can combine. And we also have to take into consideration the cost and also your insurance plan. So again, bringing up these concerns to your team at your appointment. And I often tell everyone to write down their questions. They can always send it to us through the electronic chat, but write it down in between your appointments, because you want to be prepared when you come in for your appointment with things that you might not understand. Is your medication plan just too complicated for your lifestyle? We have patients tell us all the time, I just can't remember. I don't like the medication timing. I just can't afford it. So we really work with a lot of different choices, and we want to include you in that planning. The amount of medication you take is critical, whether or not you need to take it with food or on an empty stomach. These are all things that we, as educators and as providers, go over and review with you. But as you can see, it's a lot of information. But all of this is really critical when you're taking your medication, to make sure we know you're taking it correctly and see how it monitors. Okay, we talked about side effects and the importance of writing it all down. It may or may not be a side effect from the medication, but unless you tell us, we might not be able to help you or understand how we can prescribe it differently. Sometimes we can divide the dosage so that the side effects become lessened. And also sometimes the side effects will change and disappear after you've become accustomed to the medication. We also want you to not miss any medication. So if this is happening in between appointments and you're delaying your medications because you're having a problem, you need to communicate that so we can come up with an alternative strategy, because we don't want your glycemic control and your blood sugars to slip and your diabetes or your weight to go up as a result of complications or side effects from the medications. And then lastly, we want to make sure you know how to store your medications. Many medications need to be refrigerated, and also they have expiration dates. So we want to make sure that you're watching it. So how do you kind of put it all together? If you're following a meal plan and you're exercising and you're taking your medication, how do we know if you're successful? And how do we know if the medication and the plan is not working? So we're really, fortunate, especially today because of technology and the changes that we've seen in the field of diabetes. For many of you, if you've been using only blood glucose monitoring for a long period of time, that can be difficult. It only gives us 1 point and 1 measurement, even though it's still important. So what are we looking at when we're talking about monitoring? Number one, we're not just talking about monitoring your blood sugar, which is critical. We're also talking about monitoring other areas of your treatment plan, such as your eye exam yearly or going to see a podiatrist. So we have to monitor all of the changes that might be occurring over the course of having prediabetes and diabetes. So when we look at your blood sugar control, we're going to come up with safe goals and target ranges so that you understand when you're using a blood glucose monitor or you're using the new continuous glucose monitoring devices, that you know exactly what is a specific target for you. In general, the ADA, the American Diabetes Association, has set safe targets before the meal, somewhere between 80 and 130 milligrams per deciliter, whether it's on a blood glucose meter or a continuous glucose monitor. And 2 hours after the meal, in general, we'd like your blood sugar to be below 200 or 180. Okay, so when we're working with your team, you want to make sure as you monitor that you will gain insights into your diabetes self-care. So when you have all this data, we often will ask the patients to share their data with your clinic and your providers so that we're really able to look at your information together with you, along with your food records and your other information, so we can see how your total plan is working together. So it can be a little overwhelming initially when you go on a continuous glucose monitor, because from the days when we had 2 or 3 blood sugars or 1 blood sugar a day, now we have blood sugars 24/7. And every 5 minutes, the continuous glucose monitor is providing data. But it really has been enlightening to a lot of patients and help them to really better understand what their food, their medicine, and their activity. So I really encourage any of you who are struggling or have never used a continuous glucose monitor to discuss it with your provider, even if it's put on for short term, because it really helps with problem solving and it kind of lifts the light and takes you out of the dark in areas where you might be struggling and you don't really know how you're doing with your plan. So let's also talk about problem solving, which for us, it's as big a part as the management scheme, because we're really wanting to include you in the problem solving. And also we do a lot of coaching to help you get over obstacles or barriers that aren't working. So what kinds of things are we looking for when we do problem solving? Number one, we want to identify the problem. So whether it's that you can't take medication because of side effects, or that you can't afford the medication because you just don't have the resources and the copays are high, or you're struggling with your meal plan because you have difficult working hours, or you don't have access to food. So a lot of these things we want you to be able to trust and identify without judgment that we can help you, but we have to identify what's the biggest barrier and problem. The second thing is we want to together find solutions, and then we also want to take action. So we develop a plan. So for instance, identifying the problem. Has anything changed, or is anything going to change? So that might create a problem for you. The timing of your insulin, or that you're going to be traveling. Some common scenarios, around food. Maybe, you have an allergy, or you're going on vacation, or you recently you eat out a lot, or you play a sport. We kind of want to understand. So when we meet with patients, we do a comprehensive assessment of their lifestyle, of their activity, of their food, so that we really can help identify where there is a problem. And then we look together and we work together, both the provider and our team, to find solutions. So whether it's, if you misunderstood the treatment plan, or you have a lifestyle situation that recently changed, new tools and resources like the continuous glucose monitor. We want to offer you different technologies, like using an app that might make it easier for you to identify foods, or maybe use a new technology or a new medication, and also providing you with more information and education to help you come up with the right solution. Sometimes patients just don't know where to begin, and that's where the team helps them. And then lastly, we want to find different actions, and we want to identify small goals, small steps, and kind of begin to make some changes and see where you might need help and where it might work. I saw a patient this morning who implemented 2 major changes in his meal plan. And they made a significant difference. His hemoglobin A1C went from a higher range into the normal range just by 2 implementations of the changes that he decided were the right changes and recommended by the healthcare team. So we make a problem list. What do we notice? What's the problem? What do we think would be a good solution? And then we pick and choose what do we want to work on first. Sometimes we just pick one solution, right? And then we'll try it. If it doesn't work, we'll continue to work with the patient until we try to get as much success as possible. And why do we do this? We want to reduce all the risk possible so that you don't develop any problems long-term with diabetes. So what does this mean, reducing risk? Changing behaviors that we know can contribute to problems and negative outcomes. So we talked about some positive lifestyle changes, like incorporating going for a walk every day, participating in diabetes prevention and education classes. Nationally, we know that most patients have not received diabetes education over the course of their diabetes ever. And so we encourage patients, it's covered under your insurance. Everyone's entitled to diabetes
You want something,
education
Tony?
and nutrition
Okay.
education under your
There you go.
Medicare and Medicaid plan. Also, we recommend that you have adequate sleep. Oops, sorry about that. And sleep is critical. So we evaluate sleep patterns and talk to you about how this would be important. We also getting recommended vaccines and health screenings. We want to make sure that you're doing that to protect yourself from infection. And also acknowledging prevention actions that you can take now, which will benefit you for years to come. So there's a diabetes prevention program that was instituted many years ago by the government, and it's for patients who have pre-diabetes. They have a diagnosis and they are enrolled in this program for a year. And this program has shown effective. It's 1-year program, and they meet once a week. And then once they're in the program for 6 months, they meet every other week and then monthly towards the end of the program. And it has proven to, with intensive management lifestyle changes, it's been able to, compared to medications, not necessarily metformin, but it's been able to prevent or slow down or prevent the progression of diabetes. So we encourage people to incorporate and look into, we do have a diabetes prevention program here at Cornell. And if you are newly diagnosed with diabetes, pre-diabetes, we encourage you to enroll into the program so that we can prevent diabetes from progressing. And so the target is that initially is facilitating and helping with healthy weight loss, healthy lifestyle changes. And the goal is to lose approximately 7% of body weight, but also to come up with an individualized medical nutrition plan and work with a nutritionist in a peer-supported group. So as far as diabetes education, here at Cornell, we think, and the American Association of Diabetes Educators says that there are critical times when you should not only meet with your provider, but also be meeting for education so that you can work on these strategies that we talked about today. So the 4 critical times are when you're newly diagnosed, because you can see, even with diabetes management now, there's so many different things that are critical that you have to learn: how to do your meal plan, how to take your medications correctly, how to dispose of your medications, when safe to exercise. So in the beginning, when you're first diagnosed, it's really important that we get to know you as an individual and help you to begin to incorporate those strategies. We also recommend that at least once a year, you come back to learn or ask questions. So whether it's meeting with the nutritionist or the certified diabetes care and education specialist, we can introduce you to new equipment, make sure that you're taking your medications correctly. We can change your meter if necessary, and we can teach you about new medications and discuss barriers or problems that you might be having. So, and also anytime you experience any kind of difficulties. So we really try to encourage people, if they are hospitalized, to notify us so we can make sure that you're safe in the hospital, especially if you're going into the hospital with lots of equipment and they're changing your medications. We want to make sure that you're going in and out of the hospital for procedures safely and making sure that your diabetes is well controlled while you're in the hospital and after you come home, especially if you start on new medications. So that's also a great time to reach out to your team and say, you know, come in for an appointment and a checkup. And then lastly, sometimes you need to do it when you have situational life circumstances that change. People move, they change their jobs, they have other kinds of things that are critical. So we want to make sure that people really understand that your living situation or your insurance could change. And unfortunately, sometimes with your insurance changing, that could also dictate the type of medications you're on. So we might have to prescribe a different medication so it's not as high a cost for you. And we want to make sure that we're working with you to put you on the best medical regimen possible at the lowest possible cost regarding your insurance. So hopefully today, you know, we've covered a lot of information. And I just want to make sure that all of you realize that working with your healthcare team, we're your partners. And we want to make sure that you're communicating and asking questions. Appointments sometimes can be overwhelming and quick. And sometimes you leave and you forgot what you wanted to ask. So I always tell patients, write down your questions, make a little notebook before you come, the week before or the day before, take all your information out, so that when you get to the doctor's office or you meet with the nutritionist or you meet with the diabetes educator, that you really go over, these are the top 3 or 4 things that I really need addressed today. So I want to make sure we have time at our appointment, because remember, it's your plan and we're here to support you and educate you. But once you leave, we want to make sure that you are clear and you have a good vision of what you're going to do in terms of working on your individual goal, your strategy, and your plan to help control your diabetes, because it's difficult and it's day in and day out that you're working on your diabetes. So we want to be making sure that we're providing you with the support, the education, and the information that you need. So hopefully today I've provided you with a sense of an overview of the strategies we use as a team, and hopefully highlighted the areas that we can help you with here at Weill Cornell. So if anyone has any questions, we are open for questions. Karen, my colleague, is here on the line. She's a certified diabetes care and education specialist and also a nutritionist with many years of experience. So if you want to open for questions or look in the chat, we'll be able to answer your questions.
There were a couple of questions from the
Okay.
chat before. One question is about the chart on the hemoglobin A1C, fasting glucose, and oral glucose tolerance test. I think the question was, do you take all three into account for diagnosis?
Typically, they, as I had mentioned, a hemoglobin A1C as well as a fasting blood sugar can be diagnostic. So you don't necessarily have to have an oral glucose tolerance test, although oftentimes with gestational pregnant women, they will confirm. But today, the diagnostic tools, and Karen, you can speak because you teach the gestational classes, that a hemoglobin A1C and a 2 random blood sugars are diagnostic, meaning that you can make the diagnosis of type 1 or type 2 diabetes and prediabetes.
And the second question was about steps per day. Larry, I think you are the one that
Yeah, you hear, there's this myth floating around the internet, 10,000 steps, like it's some kind of magic number, followed by, no, 10,000 steps is not the magic number. That leaves us really, really confident in our decision-making.
You know what? They recently changed it, but it is still out there, 10,000. But they're saying as long as you're getting, activity and movement every single day, it's great to be able to reach 10,000 steps, but not everyone has that time because of their work. Karen, you can speak to it as well. So yes, right now 10,000 steps is the magic number, but we've kind of heard recently that 8,000 steps would be great, and different types of movement, that it's not just walking, that you really need to incorporate strength training because we want to have, use different muscles and build muscle, all over our body. So it's almost better to try different types of activities. Karen, would you like to add to that?
I can take
No,
a walk in Central Park for 2 hours and maybe I'm getting 5, 6, 7,000. 10,000 paces is a lifestyle. Like you're not doing anything else but walking.
Yeah.
So I've
Well-
got a problem with that number. I would think 2 hours a day is a really good number in terms of walking.
2
Oh,
hours.
absolutely.
Yeah.
But to then say I'm only doing 5,000 steps, well,
Right. And that's just, sort of an average, like, some days you may get more, some days you may get less. And if someone's not really moving that much, they may want to get an idea of how many steps they're taking, and then just, let's say they're only doing 3,000 or 4,000 steps, they could, have a goal of like increasing their total steps by 500 to 1,000 every few days to achieve, better fitness.
Right. And also maybe slowly increasing your pace, but we certainly don't want you to do anything unless you're wearing a tracker and you're safe under your physician's guidance. And you're also walking on a safe environment, because you don't want to start trying to get your steps in and not paying attention where you're going. And we don't want you to fall. So I think you're doing great, Larry. Keep walking.
And then a question asks, why do diabetics get sleepy?
Okay.
Pamela, I believe, asked that question. Would you be able to be a little bit more specific?
Well, I can kind of give you a little bit of information, Pamela. So if your body is not utilizing glucose well, right, and you're trying to, if your glucose is not in the cells where it can be utilized for energy, it's when you don't have enough insulin to store it, your insulin's going to actually spill out into the urine. So that's why sometimes people actually have, or store it in your liver or somewhere that it can't be readily available for energy. And so you do develop fatigue. Also, if you are carrying extra weight, you can develop fatigue. So it might speak more for your general fitness if you don't have muscle. That's why I think it's important, Larry, when you brought up your steps, it's also really important to do strength training. And these combinations of things can help you kind of get more energy, because your body's going to, your cells are going to get the nutrients and the oxygenation that it needs to give you more energy and maybe help you with your fatigue. The other area that you have to be really, really careful about is how is your sleep, your quality of sleep. And so a lot of patients with diabetes might have sleep apnea, or they're getting up multiple times during the night, which could be a sign of sleep apnea or just a sign of poor control. So you want to make sure that you're getting a good 8 hours of sleep, 7 to 8 hours of uninterrupted sleep. And if that could be playing or contributing a role in fatigue or stress, right? Stress because of your diabetes, or your stress because of the management. That's why early on I put the coping, because you have to get education and support so that diabetes doesn't rule your life. It's a part of your life, but it's not what, and we actually, one of the things I just want to mention is we don't even really call patients diabetics. We say people living with diabetes, right? Because we want to, you understand that this can be a manageable disorder or a condition, but it takes different strategies. And one of them is positive coping skills. Okay, so getting back to the fatigue can come about because of a lot of different things. So we don't necessarily know, is it the diabetes? It could be poor nutrition. It could be, other kinds of conditions that you might have comorbidities or multiple other chronic conditions. Any other questions, Karen?
Yes, there was a question by Serena. I do not, she wrote, I do not have diabetes, but I want to know how to be supportive to my loved one. She checks her blood sugar very often and sometimes gets anxious. How can I support her?
Well, that's a great question. And honestly, I think it's the best way is to ask the person living with diabetes, how can you support them? Because oftentimes some people like to talk about it. Some people want to kind of be left alone. Some people want co-management. A nice way to support someone is to go out and maybe do activity with them so that they have an accountable exercise partner, or participate in a fundraiser. Karen can speak to some of the activities that we've done here at Cornell. And, during National Diabetes Month, we'll do diabetes walks and different kind of events where you come out and support your loved one. And that might be a nice way. But I would definitely say, I think it's very, it's wonderful that you're even asking. And I'm sure your peer or your partner would love the fact that you're just asking that question. So I would even ask them, how can I help you? What can I do to be of support? I think it's great. Other questions?
Pamela said, thank you for your response. It was clearly explained. And another question just came up. How do I get a good night's sleep when I wake up once or twice every night to use the bathroom? I am pre-diabetic.
Pre-diabetic.
Yes.
Okay. So there's a couple of things. Number one, if that's happening on a regular basis, I would limit my fluids. Karen will tell you in the evening. And certainly if it continues and you find that you're waking up tired, you may want to discuss it with your provider. I don't know, sometimes other medications that you might be on for other things like blood pressure could cause you to also have increased urination during the night. But certainly it could be an underlying cause of sleep apnea. So you might ask your spouse, are you restless? Are you snoring? Are there other signs? And secondly, you could always discuss it with your provider, because they can do a home sleep study to see if there's underlying sleep problems. And also if you're stressed, right? So there's a lot of things they tell us to do in the evening so that your body kind of winds down and you get your circadian rhythm. Your flow of your hormones in your body is very dependent on your routine and your circadian rhythm. So you want to really make sure that your body's winding down in the evening. You're not eating a lot of food, you're not drinking a lot of fluids, and you're preparing quietly for sleep, which is a restorative time when your body gets to rest and recover from a busy day. So, and also just from ongoing health issues. So as to your question, I would say if you're repeatedly getting up and you've tried these other strategies and you're still not sleeping, I would definitely bring it up to your physician and explore whether or not you have underlying sleep issues. Other questions?
Not yet.
Okay.
Do you mind sharing your contact information?
Oh, yeah, sure. We could send it to you and you could send it out. That would be great.
Sounds good.
And also, you know, we hope to come back in the future with ongoing other additional programs with our team. So hopefully you'll join us again and, you know, certainly give us any comments of ways we can improve and deliver educational programs to you.
Thank you very much.
Oh, you're welcome.
This video